Hello class, welcome to this week's presentation on mental health and my reflection. So currently I am in the psychiatric mental health nurse practitioner track, so I did enjoy this week's material as it is track specific to me. I am especially interested in this week's material and I can't really speak to anything that surprised me because I do have a lot of clinical experience in this area based on the topics that we've discussed this week. Um, I can say that I'm not surprised how short the section was in chapter 14 related to mental disorders. Because unfortunately, I have always felt that, especially in the beginning of nursing school and progressing forward now into graduate school, the topic of mental health disorders is not highly studied, which is why there are still so many stigmas attached to mental health in healthcare, and how sometimes practitioners can be biased and have preconceived notions about the populations with mental health disorders. So after reviewing this week's materials, I learned a lot about more of the pathophysiological changes, the biochemical and structural brain abnormalities related to mental health and how they contribute to these disorders. I also learned the comparisons between different disorders such as schizophrenia, depression, anxiety, and panic disorders. And I also learned how to differentiate between the disorders. And lastly, I learned how certain structural disorders can mimic mental health disorders, which is why it's important to have a full range of knowledge from the pathophysiology to the biochemistry and finally into the psychiatric diagnoses based on the DSM-5. So with regard to substance abuse disorders, I learned that chemical dependency is the newer term for addiction. I'm familiar with substance use disorder as healthcare providers transitioned into that term a few years back. And I also learned that substance abuse has made the World Health Organization's global priorities. They're listing it as wanting to combat the epidemic, especially with the opioid epidemic. And lastly, I learned about what they call an M&M party, which is highly disturbing to me because I have children that are the teenage age. And it's when teens or adolescents go through their parents' medicine cabinets and get prescription and non-prescription medications and mix them all up and put them in a bowl, and I guess are using them to try to get some kind of physical reaction to the substances. So that's kind of disturbing to me because I don't think that, especially with the underdeveloped frontal lobe, these children aren't understanding the ramifications of their actions and a lot of times have bad influences based on social media or just not knowing the consequences of their actions, and unfortunately this can lead to either imminent danger, meaning death, or psychological factors or physiological factors that can then lead them on a path to chemical dependency, which will lead them down the path of substance use abuse and ultimately ending up with a substance use disorder. They can end up with chemical dependency, and especially if there's a genetic predisposing risk factor, if there's addiction that runs in the family or mental health disorders, some of these substances can trigger things in the brain, and these disorders can then present themselves. So that was something that was kind of disturbing to me that I learned. And I was familiar with, I mean, not to that degree, I wasn't really familiar with kids and teens doing that, so that is kind of disturbing. Um, so other than that, I mean, I am pretty familiar with substance use disorder, mental health disorders. I mean, every field really has some part of that in their field, whether it's going to be um, women's health or just adult or really there's mental health that's woven through all of the tracks. So I think that it's really important that nursing school and other specialties really take a larger focus on it, because it is becoming such a prevalent problem, especially in today's day and age with teens and social media, and mental health has really become an issue for a lot of people. So with that, I am blessed to be going into the psychiatric mental health nurse practitioner role, because there is such an increased need for mental help, and I will be better able to educate my patients based on the information that I have learned in this week's material, as short as it was. And I will be able to better decipher between medical conditions from psychiatric disorders and see how they overlap, and that will enable me to treat my patients on a more holistic level. So that is the end of my presentation, and I want to wish you all the best of luck in whichever field you're going into, and I hope that everyone is well, and take care. Thank you.